Did you know that nearly 70 million Americans over 60 could be directly impacted by new laws in 2025? Laws that decide everything from how much you'll get in Social Security to how much you'll pay for medicine, housing, and even taxes. What if the rules you've relied on your whole life suddenly change overnight? Across the country, lawmakers are rewriting policies that could affect your savings, your health care, and even your rights as a citizen. Many seniors don't even know these changes are coming. The real question is, are you prepared? Stay with us because in this video we'll uncover the 10 most important laws every older American must know before it's too late. Number 1. Social Security adjustments. For millions of older Americans, Social Security is the lifeline that keeps food on the table and lights on at home. But in 2025, the rules around benefits are shifting again, and the impact will be felt in nearly every household. The government has announced new cost of living adjustments, SIOLE, designed to keep up with inflation. On paper, that sounds like a blessing, but the reality is more complicated. Inflation doesn't hit all groups equally. Seniors spend more on healthcare, housing, and food, items that often rise faster in price than the general index used for COLA. That means your benefits might look slightly higher on paper, but in real life, they may not stretch as far as you think. What makes this even more concerning is that Social Security trust funds are under pressure. Experts warn that by the 2030s, without reform, funds could run short, leading to reduced benefits. Lawmakers are using 2025 as a testing ground for adjustments, and seniors need to pay attention. If you don't track these changes, you could underestimate your monthly income and fall behind on essential expenses. And for retirees on fixed incomes, even a small miscalculation can spiral into debt or sacrifice. The key takeaway is simple. Don't assume your check will cover tomorrow what it covers today. Review your statements closely, understand how the COLA affects your personal budget, and consider supplementing Social Security with other sources of income if possible. For older Americans, knowing these rules isn't just about staying informed, it's about survival. Imagine realizing too late that your check no longer pays the bills. That's the risk of ignoring the 2025 adjustments. Staying informed today means being protected tomorrow. Number 2. Medicare reform. Healthcare is already the single largest expense for most seniors, and in 2025, Medicare reforms are set to reshape the system in ways both promising and risky. On one hand, the government has pledged to expand preventive care services, meaning older Americans could access screenings, wellness visits, and telemedicine at little to no extra cost. These changes aim to keep seniors healthier longer, catching problems before they become expensive crises. But here's the catch. While the coverage is broadening, so are the premiums, deductibles, and copays. For someone on a tight, fixed income, even a small increase can feel like a major blow. Another major shift comes with prescription drug price negotiations. For decades, pharmaceutical companies held enormous control over medication prices, but in 2025, Medicare will negotiate directly on a growing list of essential drugs. While this sounds like relief is on the way, not all medications make the list. Seniors who rely on drugs outside the negotiated pool could still face staggering costs. Imagine needing a life-saving pill only to discover its price hasn't changed because it wasn't prioritized for negotiation. The reality is bittersweet. While many will see savings, others may find themselves still paying hundreds of dollars a month. So, what can older Americans do? The most important step is to review your Medicare plan carefully each year. Don't assume last year's coverage still works for you in 2025. Take advantage of open enrollment, compare drug formularies, and consult with trusted advisors who understand the system. These reforms may be confusing, but ignoring them could mean losing money or missing out on services you've earned. Medicare reform in 2025 is not just about policy. It's about protecting your health, your wallet, and your independence in the years ahead. Number 3. Retirement tax laws. For decades, many older Americans have relied on their 401ks and IRAs as the cornerstone of retirement. But in 2025, the government is changing the rules on required minimum distributions, RMDs. And if seniors aren't careful, these shifts could mean losing thousands to taxes and penalties. RMDs are the withdrawals you're required to make once you hit a certain age, and new rules will raise that age for some retirees while adjusting withdrawal percentages. At first glance, this may look like flexibility, but in reality, it can create confusion and financial missteps for those who don't plan ahead. The danger lies in the details. If you withdraw too little, the penalty is massive. 50% of the amount you should have taken out. If you withdraw too much, you risk running out of savings earlier than expected. Add to this the fact that tax brackets are shifting in 2025, and suddenly, retirees could find themselves paying higher taxes even when their income hasn't changed. For many, it will feel like walking a tightrope. Take too little and get penalized. Take too much and pay more in taxes. Without guidance, seniors risk losing control of the nest egg they worked decades to build. The solution? Stay proactive. Don't wait until tax season to figure out your withdrawals. Consult with financial advisors, review how your RMDs interact with Social Security, and consider strategies like Roth conversions or staggered withdrawals. These laws aren't meant to punish seniors, but without proper planning, that's exactly what can happen. In 2025, the difference between thriving in retirement and struggling could come down to knowing the tax code and applying it wisely. For older Americans, this knowledge isn't optional, it's essential. Which of these laws do you think will impact seniors the most in 2025? Share your thoughts in the comments. We'd love to hear your perspective. And if you found value in this video, please subscribe. It's just one click, but it helps us keep creating content that protects your future. Number 4. Inheritance and estate taxes. For many older Americans, the dream is simple: to leave behind something meaningful for children or grandchildren. But in 2025, changes in inheritance and estate tax laws could alter how much of that legacy actually reaches loved ones. The federal estate tax exemption, which has been historically high, is set to sunset back to lower levels, meaning more families may suddenly find themselves subject to estate taxes. What was once a concern only for the wealthiest households may now impact middle-class families who own property, farmland, or retirement savings. This shift could mean that assets you've worked for your entire life are suddenly subject to higher taxation. Imagine leaving behind a house valued at $500,000 or more, only to have your heirs face unexpected tax bills that force them to sell the property. For seniors who spent decades paying off mortgages or investing carefully, the idea of losing family homes or savings to taxes is heartbreaking. And with state-level estate taxes layered on top in certain regions, the burden can be even heavier. What can seniors do about it? The key is planning now, not later. Older Americans should consider setting up trusts, reviewing wills, and exploring gifting strategies that reduce taxable estates. Professional guidance is critical because the rules are complex and vary by state. Knowing the 2025 estate tax changes isn't just about money, it's about protecting family stability and honoring the legacy you want to leave. By being proactive, seniors can ensure their life's work benefits their loved ones, not just the government. In a time when rules are shifting, knowledge truly becomes the greatest inheritance. Number 5. Prescription drug pricing. Few things hit seniors harder than the rising cost of medicine. In 2025, one of the most significant legal changes comes with the government's expanded power to negotiate prescription drug prices under Medicare. For the first time, a wider list of essential medications, like those for diabetes, heart disease, and cancer, will see lower negotiated prices. On the surface, this sounds like a victory for older Americans who have been crushed by monthly pharmacy bills. But the reality is more complicated. Not all medications are included, and pharmaceutical companies are already warning that cuts in one area may mean higher costs elsewhere. For seniors, this creates a dangerous gray zone. Imagine relying on a drug that doesn't make the government's negotiation list. You could still face skyrocketing costs while others pay less. Some insurance plans may also change their coverage in response to the new rules, leaving patients with unexpected copays or limits on which pharmacies they can use. And while the reforms aim to protect seniors from price gouging, many analysts fear the industry will find loopholes that shift the burden back onto consumers in hidden ways. For those living on fixed incomes, this could turn life-saving medicine into an unbearable financial strain. So how can older Americans protect themselves? The smartest step is to review Medicare Part D plans carefully during open enrollment, making sure your specific prescriptions are covered under the new pricing rules. Talk to your doctor or pharmacist about generic alternatives, and don't assume that last year's plan will still save you money in 2025. Staying informed, asking tough questions, and shopping around can make the difference between affordable care and financial hardship. These drug pricing laws could be a breakthrough or a trap for seniors, depending on how prepared they are. Number 6. Long-term care regulations. For older Americans, the question of long-term care is no longer if, but when. In 2025, new regulations on nursing homes, assisted living facilities, and home care services are being rolled out across the country. These laws aim to increase transparency, improve safety standards, and hold facilities accountable for neglect or abuse. On paper, that sounds like a win for seniors and their families. But with every new rule comes added administrative costs, and many facilities are already warning that higher compliance expenses will be passed down to residents. For seniors relying on Medicaid or fixed savings, that could mean thousands more in annual care costs. Another major shift is the requirement for facilities to publish clearer data on staffing levels, health inspections, and patient outcomes. This gives families a better chance to compare facilities and make informed decisions. Yet it also reveals just how fragile the system really is. Many nursing homes are already understaffed, and stricter standards could force some to close their doors altogether. In rural areas where options are limited, closures could leave families scrambling to find care within reasonable distance. The law may expose weaknesses, but it doesn't necessarily fix them. For seniors planning ahead, the key is proactive preparation. Explore long-term care insurance if it's still affordable, and discuss with family members what type of care you would prefer before a crisis hits. Keep track of facilities in your area and don't wait until the last minute to evaluate options. These regulations are meant to protect older Americans, but without careful planning, they could create just as many challenges as solutions. Knowing your rights, understanding the costs, and planning for care now could save you from overwhelming stress later. Number 7. Housing and rental laws. For older Americans, housing is more than just shelter. It's stability, safety, and dignity in retirement. In 2025, housing and rental laws are shifting in ways that could either protect or pressure seniors, depending on where they live. Some states are expanding tenant protections, limiting rent hikes, and strengthening rules against unfair evictions. For retirees renting apartments or senior housing, these measures could provide crucial stability. Yet, in other states, lawmakers are moving in the opposite direction, loosening regulations and allowing landlords to raise rents more aggressively. For seniors living on fixed incomes, even a small monthly increase can mean cutting back on essentials like medicine or food. The situation grows more complex with the affordable housing shortage. In many cities, demand for low-income senior housing already far exceeds supply, and waiting lists can stretch for years. With property taxes rising and developers often targeting younger professionals, seniors risk being pushed out of communities they've called home for decades. Laws in 2025 will play a decisive role in shaping who gets priority access to subsidized housing and whether rent control remains a shield or fades away. Without these protections, some older Americans could face the devastating reality of housing insecurity in their later years. What can seniors do? Awareness and advocacy are critical. Older Americans should stay informed about local housing laws, attend community meetings, and explore assistance programs that offer rental subsidies or property tax relief. For homeowners, keeping up with changing property regulations can help prevent surprises in tax bills or zoning restrictions. Housing is the foundation of independence, and the laws of 2025 will test just how secure that foundation really is. By staying informed and proactive, seniors can protect their homes and their peace of mind in a changing legal landscape. Number 8. Healthcare privacy, AI. In 2025, one of the fastest growing shifts in senior healthcare is the rise of artificial intelligence, AI. From remote monitoring devices to AI-assisted diagnoses, older Americans are increasingly relying on technology to manage their health. But with these advances come serious concerns about privacy and data security. New healthcare privacy laws aim to regulate how sensitive medical information, like heart rate, medication history, or even genetic data, is stored and shared. For seniors who use telemedicine or wearable devices, this means more protection on paper, but also more risk if companies fail to comply or data is hacked. Imagine discovering that your medical records have been sold to insurers or marketers without your consent. Another challenge is accuracy and accountability. AI is designed to speed up care and reduce human error, but it's not perfect. Mistakes in algorithm-driven diagnoses could lead to seniors receiving the wrong treatment or missing critical early warnings about disease. Lawmakers in 2025 are grappling with questions like, who is responsible if an AI tool makes an error, the doctor or the technology company? These uncertainties leave seniors vulnerable at a time when trust in healthcare is more important than ever. So what should older Americans do? The best step is to stay informed and ask questions. If your doctor uses AI tools, don't hesitate to ask how your data is being protected and whether human oversight is involved in decisions. Consider limiting how much personal health data you share on apps or devices without clear privacy guarantees. AI can revolutionize healthcare access, especially for those who struggle to travel for appointments, but seniors need to balance convenience with caution. In 2025, knowing your rights around healthcare privacy is not just smart, it's essential to protecting your health and your dignity. Number 9. Elder financial protection. Financial scams targeting older Americans are at an all-time high, and 2025 brings new laws designed to fight back. Seniors are often seen as easy targets because many manage retirement savings, pensions, or home equity, and scammers know how to exploit trust. In fact, billions are lost every year to fraudulent phone calls, fake charities, or investment schemes that prey on vulnerability. Recognizing this crisis, lawmakers have introduced stronger protections requiring banks and credit unions to flag suspicious transactions and report them before money disappears. On paper, this creates a safety net, but in practice, many seniors don't know these protections exist or how to use them. The danger lies not only in professional criminals but also in financial exploitation by family members or caregivers. In 2025, laws expand the ability of courts to intervene when elders are pressured into changing wills, signing over property, or making large withdrawals. Yet, legal protection only works when abuse is reported. Sadly, many cases go unnoticed because seniors fear damaging relationships or simply don't realize they've been manipulated. With aging populations growing, these hidden crimes are expected to rise unless older Americans learn how to spot the warning signs early. What can seniors do? The key is vigilance. Monitor your accounts regularly, set up alerts for unusual activity, and don't be afraid to question financial requests, even from people you know. Take advantage of free workshops or resources from senior advocacy groups that explain how these new protections work. Knowledge and prevention are the strongest shields. The laws of 2025 can provide powerful backup, but only if seniors recognize their rights and use the tools available. By staying alert and informed, older Americans can protect not only their money, but also their independence and peace of mind. Number 10. Voting access laws. In a democracy, the right to vote is one of the most powerful tools seniors have to shape the future. But in 2025, new voting access laws across several states could make casting a ballot more complicated for older Americans. Many states are introducing stricter voter ID requirements, shortened mail-in ballot deadlines, and fewer drop-off locations. For seniors who rely on absentee voting due to mobility issues or health concerns, these changes could mean more obstacles than ever before. What was once a simple process of mailing a ballot may now require navigating additional paperwork, stricter deadlines, or even multiple trips to polling stations. The concern isn't just convenience, it's representation. Seniors make up one of the largest voting blocs in America, and laws that make it harder for them to participate could dilute their influence on critical policies that affect Social Security, Medicare, and retirement protections. Imagine a retiree who has voted faithfully for 50 years suddenly being told their ballot doesn't count because it arrived one day late or lacked an updated ID number. For older Americans, these small changes can have massive consequences, silencing voices that have carried the weight of experience and wisdom for decades. So how can seniors safeguard their rights? The answer is preparation. Check local election rules early, apply for absentee ballots well ahead of deadlines, and confirm that your identification is valid under new laws. Community organizations and advocacy groups can provide guidance, but it's up to individuals to act before Election Day arrives. In 2025, protecting your right to vote is not just about politics. It's about defending your voice in decisions that directly shape your future. Staying vigilant ensures that seniors remain a powerful force in American democracy, no matter how the laws change. The year 2025 is shaping up to be one of the most important turning points for older Americans. From Social Security and Medicare reforms to housing, healthcare, and inheritance laws, the landscape is shifting quickly, and the consequences will touch every corner of senior life. These aren't distant possibilities. They are changes that will impact how you spend, how you save, and how you live right now. The truth is, many of these laws are designed with good intentions, protecting seniors, strengthening systems, and ensuring fairness. Yet, without awareness and preparation, even positive reforms can create confusion, financial hardship, or unexpected risks. The difference between being caught off guard and staying secure is knowledge. For seniors, every dollar matters, every decision counts, and every right deserves protection. Understanding these 10 laws isn't just about following politics. It's about safeguarding your dignity, independence, and peace of mind. In a world where rules keep changing, the power lies in being prepared. So as we look to 2025, the question isn't whether these laws will affect you, it's how you'll respond. By staying informed today, you can take control of tomorrow. So what can older Americans do in the face of so many sweeping changes? The answer is not fear, it's strategy and preparation. Each of these 10 laws may seem overwhelming on its own, but taken together, they form a roadmap for where seniors must focus their attention in 2025. Start with your finances. Review your Social Security statements, Medicare plans, and retirement accounts. Don't assume last year's benefits or withdrawals will work under this year's rules. Seek professional advice where needed and explore resources offered by community organizations or senior advocacy groups. A small step today could save you thousands tomorrow. Next, protect your legal and healthcare rights. Make sure your wills, trusts, and powers of attorney are updated to reflect estate tax changes. Learn how AI and privacy laws affect your medical care and insist on transparency from providers. If you rely on prescription medications, compare drug plans carefully and discuss affordable options with your doctor. Finally, safeguard your independence. Stay active in your community, keep track of local housing laws, and know your voting rights. Talk to family members about long-term care preferences before a crisis forces decisions. Remember, knowledge is more than power. It is protection. The solution is not to wait for these laws to happen to you, but to take action before they do. With preparation, older Americans can turn these challenges into opportunities, ensuring 2025 is not a year of loss, but of empowerment. Which of these laws do you think will affect seniors the most in 2025? Share your story in the comments. We'd love to hear your perspective. And before you go, don't miss our previous video, packed with insights you can't afford to skip. We put so much effort into bringing you this content, so please subscribe. It's just one click, and it means the world to us.